Hi, this is Dr. Veerle van Tricht, burnout expert, and I'm very, very excited to have with me Danna Pycher, who is an international motivational speaker, and she also has spoken on TEDx, which is pretty impressive. She's a hypnotherapist and the founder of the Transformation Clinic. So Danna, you specialize in healing trauma, stress and anxiety, autoimmune disorders. That is very big with my eye clients. I mean, I have a lot of ophthalmology clients who have uveitis, and so I would love to talk about that also. And then you also work with people who need to lose weight, and I'm sure you do a lot more. So you work with people from all over the world. And I so agree with you that emotional issues create a lot of physical distress. And I love setting people free from their emotional trauma because, yeah, I love doing that kind of work. I really do. But I'm really eager to hear how you approach these issues. Tell me a little bit more about how you, yeah, work with your clients in your practice.
Thank you so much, and thank you for having me and for the intro. I came to discovering the depth of how our emotional world helps to, or doesn't help, or is detriment to our physical reality because of my own need. And it's kind of a little bit of a winding road as to how I little by little discovered the fact that repressed emotions are basically coming up in the body as a communication
Yes.
through pain, right? Through pain, it's a message that's being sent, and the only way the subconscious mind can speak is through sensation, is through feeling. That's its mouthpiece.
Yeah.
So discover that as being the theme. When you can learn how to work with your subconscious mind, then you can liberate these feelings, calm it down, turn it down, and thereby also work with your physical feelings.
Yeah. Yeah, excellent. I don't know whether you've ever heard of The Journey. The Journey is a book written by Brandon Bays, and I studied a year with her to actually learn techniques, including hypnotherapy, NLP, to go to somebody's pain, let's say pain in the shoulder, and then find the underlying emotion and trauma and to set that free. And yeah, that's exactly what I love doing. Because you don't need shoulder surgery then. Or a steroid injection or whatever. I mean, I am a medical doctor, so that is often it's often very useful to see your doctor, and they can be you know, very helpful. Like I do cataract surgery many times a week, and it's like a physical obstruction that you actually see there that you remove. It's the same with people who have like an appendicitis or something acute wrong with them. I'm not saying that the medical world is completely wrong in acute disease, but there's a lot of, especially people with chronic disease and chronic pain, because if you hurt yourself, you shouldn't really have pain for longer than 6 weeks, because by then your tissue should have healed. So do you agree with that, that it's one of the signs is pain for a long time? It's not just the one headache per se because you're dehydrated, but it's the long-term problems that have this emotional yeah, it's your emotions like screaming at you louder and louder to be seen, isn't it?
That's it. That's exactly it. And it's so interesting because every time that I work with these things and I talk about it, it's always interesting that the first thing we need to do is to justify the fact that the Western medicine still has a place.
Yeah.
You know, and it's always interesting to me that we have to make that disclaimer. It still has a place. Of course, it has a place.
Yeah.
Right.
And it is a legal disclaimer also.
Legal disclaimer.
Everybody does it.
For sure, but also what's interesting is the type of medicine I need and people that I work with need and people that have any sort of chronic issues need is both worlds. We need it both. For example, it's not like I don't believe in antibiotics when you have bronchitis. Recently that happened to me, and it's like, you know, you can do all the other alternative modalities, but at the end of the day, until you get rid of it, you're going to feel that way.
Mm.
So there's that. And on the opposite end is if it is chronic, and that's kind of the differentiator, what you said.
Mm.
If there's some element of it just persists and it goes and it goes, it's communication and rather than an acute infection.
Yes.
Or a little bit of a blend of both, because I also like to say that a lot of people that I work with, everyone gets a virus, has viruses, and has been exposed to mold and these poison toxins.
Yeah.
What's the difference? Because there's a lot of people that can get sick and don't get chronically ill. So what I say is I call it the sandwich. There's some sort of emotional distress, then a virus, let's say, okay, and then another emotional distress, and then creates this sandwich that anytime there's new stress coming in, it hits that same indicator in the subconscious mind that says, oh, okay, last time I had this scenario, I was sick, therefore let that virus kind of rear its ugly head again, right? So it's not as if you were never sick. It's not as if you never had something instigated. But the chronic part is constantly getting poked.
Yeah, exactly. I love that you describe it as a sandwich, because another thing that I see a lot in my practice is people with recurrent herpetic infections in their eyes, and they're really tired of it. And I promised them I would do some research on how I could help them avoid the recurrences. Obviously I want to help them boost their immune system, but how am I going to address the fact it's going to take some work to explain to them that it's actually the emotional distress that triggers it over and over again, and it's hard to completely avoid that in life. So yeah, that is interesting. So what do you say to how do you deal with that in your clients? How can they learn to be less triggered by the emotional stressors that are in their life and in their environment?
It's a big question, because the idea is all of us more and more live in stressful lives. We can't just avoid stress. We can't avoid living if we're active in life. And one of my biggest specialties is chronic fatigue and fibromyalgia, which is very limiting, unfortunately. It's very limiting, and you depending on where you are in the spectrum, there are some people with chronic fatigue that they're like a 10, they can't move out of bed. And there are some people that fluctuate. One day they're a 1, one day they're a 6. So you have to really, the education, the re-education, you have to relearn how to live life to incorporate your amount of stress that you can have. That's number one. That's management. Number two, the deeper level, which is the stuff we were talking about a bit earlier, techniques like the journey and going hypnotherapy and doing these subconscious techniques that no matter what the stress load is in the reality, if their subconscious mind is a little bit more at peace, and I say if the bucket is a little more empty, can hold more, you're going to have less flare-ups.
Yeah, that's great.
So it's the duality of clearing out, cleaning up. You have more space and more room for the reality of stress that's in our lifestyle, and this is our life. And then the management of really, really listening to yourself and recognizing how much energy you have, yes, no. But beyond that, what I like to bring people to, and the biggest aspiration, is they don't have to manage so much. If they clean up enough, it's a lot less management, and oftentimes we can really kind of reverse these things and not have to have these flare-ups.
Okay, great. Yeah, that clarifies it for me. So how long does it take for some? I mean, I know everybody's very individual, because some people have had a lot of stress in their life, especially when you're a bit older than very young people, but they might have had a really big stressor in their life. So how long do you work with people before you feel that their bucket is sufficiently empty for them to function better?
What's so interesting is I'm working with a lot of young people now. It used to be only more I'm a bit older, but now, for better for worse, I think there's a really interesting thing happening with young people that are very, I'm correlating a lot lately with the amount of empathy, how empathic, and people are highly sensitive, which is a new fascination of mine, that sometimes I feel like people that are fatigued and have pain, they're just highly sensitive. And right?
Yeah, I know all about it. I wrote a whole book about it.
Oh,
Because
that's good.
my
Amazing.
surgery talks to angels, because I was born super sensitive and empathic, and oops, here we go, cat is here again. Even nowadays, when I have a symptom, it's often not mine. So I was operating this week and I was feeling fine until I did a certain patient and I started getting cardiac arrhythmias during surgery. And I said, this is so weird because I haven't had this for a while and this is not mine, I think. But actually, my heart was going irregular. And then it was just for this one patient. The next patient, I was fine again. Yeah, so there was something going on
So
there that I picked up on.
the the most interesting thing that I'm learning a lot about now is the fact that I can tell you 90% of the people I work with are somewhat sensitive, somewhat empathic. It never used to be like that so much, but the mass of people that I'm working with that happen to have also this correlation, you can't ignore it. So,
Mm,
that's also something that I learned that I am in my life. And why I also have to myself, if I were to go to a doctor, I need a special doctor. I need a
mm,
doctor who understands I have this aspect, and I'm
yeah,
also just a human that needs to, be
yeah.
like attended to and stuff like that. But most doctors cannot work with our type.
No, no, very hard to find somebody like that, which was probably the reason it took me about 10 years to figure out my own burnout, because I saw so many doctors who looked at either my cortisol levels or, I don't know, my digestion or my microbiome, all these little aspects, but nobody like looked at the total picture. I think probably my Chinese acupuncturist, she was like very holistic. So I found it's rare to find people who do that in the Western world. Yeah, very rare. Mm.
And you feel
And
lost.
I could do it, but it puts me in danger of not being professional, because it's yeah, it might be criticized as doing something that's not proven to be through big population studies of 10,000 people and follow-up of 10 years and double-blind studies, and there's not the scientific background. But although I can find a lot of studies where like the effect of prayer on people with heart attacks and stuff like that, that they survive longer and recuperate faster. So you find little studies like that. But yeah, I think people would frown upon it, which is a pity, because a lot of people need doctors who look at both the physical and the emotional and the spiritual all at the same time. Mm.
It's so true. The new human that has, forget anything about sensitivity or empathy or anything like that. The amount of just overwhelm in our lives of any average human. You cannot take a medication for overwhelm. You can maybe take, antidepressants or anti-anxiety, but it's not helping you process anything. So
Mm.
I really interesting. When I first started doing this work, anytime I would tell a doctor that I'm a hypnotherapist and I help, with sadness and I help with physical disease, even, everyone laughed at me. Everyone. And they're like, where's your evidence? I said, the person
Mm.
was sad. They're not sad anymore. What do you want from me? They're like, no, no, no. You need to do the studies and I
Yeah,
get it.
yeah.
I get it. But there's something at a loss here, because I was even so amazing the other day. So nowadays I have doctors coming to me, that they're at a loss. They have had burnout. They're fatigued, and they don't know how and where to get back to status quo.
Mm.
So now, most people that come to me, by the time they come to me, they've tried everything. Believe me,
Yeah.
no one comes to a therapist before trying everything else,
Mm.
and I get. So the other day I was speaking to, and I forgot what it was like in the past when I used to talk to doctors who would always tell me I'm wrong. I forgot what that's like. And I was at dinner recently, and there was a doctor there, and I was talking to her about kind of like the subconscious mechanisms behind weight gain. Why a
Mm.
woman might want to gain weight, or a man, for example, and the emotional elements of needing to be safe and making a protective layer and a protective shell. And the moment you feel safe in your subconscious, then all of a sudden you can start actually eating better, right? Because you're not sabotaging your safety. You're safe. Okay, so that makes sense to someone like you, right?
Yeah, absolutely, yeah.
So with her, first of all, blank stare. And she told me, she's like, absolutely not. Absolutely not. And I was like, well, I mean, I do this a lot, you know. She's like, no. And then it wasn't until, you know, there was some study or something about, and then she started talking about food and the relevance of how food is important for you. But they don't have any studies about it. There's not studies yet, but, you know, and I'm like, this is what you need to just trust the fact. So I used to get time. Lately, I do meet more and more doctors who are so much just leaning into integrative medicine and doing the more emotional components, because I feel as if there is a shift happening. But in the beginning, no.
Yeah, there is definitely a shift, because I've been working as a doctor for 25 years, and 25 years ago, patients would come to me like and hand over their health or their problem to me and say like, I don't know what it is, but you just fix it for me. So they took absolutely no responsibility. And now it has changed when I see people like with autoimmune diseases and things like that. And then I suggest, would you be interested in learning something that can help you with your autoimmune disease holistically? Almost 99% now says, yes, please. And yeah, so it's great, because that's what I'm trying to become, probably the first integrative ophthalmologist in the country. I don't know if there's other ones out there somewhere, because it's not an official title, definitely not in UK. There's not even any integrative doctors here, so that I know of. Unless, I mean, if I want to do the official degree, I have to go to the States, I guess. But I have so many degrees already. I don't think I'll do that again. But I'm always learning and listening, and there's a lot of information, there's a lot of great books that I'm reading from other brilliant people who have done all of the work. So yeah, there's a lot of information out there, which I'm absorbing.
Yes. And I think more and more what's becoming even more interesting for me is disease as a spiritual process, which is a whole thing, because there's so many layers of being human that are ignored in the Western world, you know, where we know we have a body, you know, that's fine, confirmed. We know we have a mind now, and we can, you know, intellectualize and then process. And a lot of what I'm more fascinated by now is how, when the subconscious mind is communicating to you through dysfunction or through addiction or through some sort of obstacle in life. My latest fascination is the spiritual evolution that happens because of it, and how to tap into that as a life journey. So rather than being in pain, and it's terrible, which it is terrible, believe me, I know, and I've been there, and I as a history, I had chronic fatigue and fibromyalgia for years, and I get it. The management, and it's confusing, and, you know, but what I'm learning more and more is that when I would go even personally and become better and heal and feel better and go through the up cycle of feeling normal human, there was always lessons being learned. There was always something I learned about life through that experience. And then you just become a collective life, you know? So I really find that it's a big journey. And if you take it as a journey and you learn and you evolve through it, your pain becomes your guide.
Absolutely, yeah. Yeah, I think often people who go through like things like burnout and chronic fatigue, they really are forced to slow down and think and reassess, what am I doing with my life? And because they can't keep on being busy, they don't have the energy to run away from it, so they're forced to actually sit with themselves. And I remember I had a very big ego crisis when I couldn't work as fast anymore, when I had burnout, and I actually ended up quitting my job for a while to recuperate and to heal. And I had this big ego crisis, like my ego said, like, no, you can't stop working as a doctor because you're not worthy of anything unless you are a doctor and you're helping people and blah, blah, blah. So my ego was like screaming at me, you're nothing without this. So I had to really go look very deep past my very little soul flame, like, do I have a purpose if I don't work and help others? And I had to really come out the other side of the big black hole thinking, yes, even if I don't work, I still deserve to live and I still deserve to exist. And I kind of feel like I'm a child of God, so I deserve to be here, otherwise I wouldn't be here. And no matter how much I perform, no matter how many cataracts I can do per week, I still deserve to be here. So I came out a spiritually different person, less attached to my worldly performances, and more loving towards my inner core, which is that the part of us that doesn't die, the soul, whatever you call it, is definitely always worthy, no matter whether you're a very fast runner or you're in a wheelchair, or, you know, apart from the outside performance, that's something that I learned, that no matter how successful you are in the eyes of the world, you still deserve to be here. And everybody plays a role, even if the role is being an ill person who teaches other people how to care. So yeah, it's very complicated, and it's hard for people who are ill to accept it. Sometimes you only see it afterwards, don't you? What the lesson was.
In the moment, it's terrible. You know, no one wants to feel these ways. Lately, what I've been doing personally is, because I went for years and years and years without pain after through hypnotherapy, you know, and without fatigue. And recently, super recently, just maybe about a year and a half ago, I started having this pain come up again. I'm like, okay, this is weird. You know, this was gone and now it's not. But my approach to it is so different. Like, I'll stop, and it's true. It's an ego battle, because I'm also the type, you know, I want to work, I want to participate in the world, I want to, you know, really be active in my life. And when I'm slammed down, don't do anything because you don't feel good, you can't move, crushes you, you know, especially if you're the type that likes to be productive, which everyone likes to be productive. So what I do now is I listen, like, big time listen, and I really feel into it. It's like, so I'll feel into the sensation, and wherever it is in my body. And the fascinating thing also with something like fibromyalgia, for example, there's going to be days that it's zero, you're not going to feel it. There's going to be days where it's extreme, and you feel, and that was always confusing to me. I'm like, why is it not the same thing every day? How is it moving? And how is it some days in my hips and some days in back here? And so what is that element, right? So I'm like, that's weird, and that's a little mysterious. Why is it changing? Why is it moving? If it's disease, as disease is known, I would feel everywhere at the same time, same thing every day. So what I started doing this time around, again, because it's new to me, I haven't had this in years, I would lay down and feel just a sensation. It's not going to harm me. You know, it's just an echo from the past. You know, and then I started asking questions. What are you here to tell me? And then I listened to it, and interesting things would come up. And those interesting things came up to be like my next lesson in life.
Yeah, so. Wonderful. I think that is like a great lesson for anybody who listens to this, because people might be wondering, how can I do this? Because it might be new to a lot of people, but basically I think it also helps sometimes, like what you did is perfect, but you obviously experienced at it. Sometimes I think if you're a beginner in this, it also helps to tap on it a little bit. And first of all, if you have a pain or a negative emotion, usually there will be a negative emotion there somewhere, not to run away from it, not to suppress it, but actually to say, I see you and I want to listen to you. Yeah, just like you say, why are you here? What do you want to tell me? And to just kind of embrace it and sit with it, and you will get the answer. Because a lot of people run away from either pain or you take something to suppress it, or even from negative emotions. They just don't want to stop and listen to it, and that's why we're always on the run. But if you get something like chronic fatigue, you can't run anymore, and then so that's the blessing, that it makes you listen to what your body is trying to tell you, or your subconscious is trying to tell you, and maybe even your spirit is trying to tell you. But if you're constantly going, you're on a different wavelength, you're not listening to yourself, right? To your inner wisdom.
So that I really feel is what chronic fatigue is. You hit it exactly how I feel about it. It's just, it's your spirit, or whatever aspect you want to say, is saying stop, slow down, pay attention to yourself. I also have this feeling that it's the inner feminine. So for example, the women mostly that I work with are very strong, it's funny, when I first was diagnosed with chronic fatigue, my doctor asked me, she's like, are you type A? And I said, maybe, why? And like, it's just a question we ask, are you type A? And I was like, yeah, I guess I'd say I'm type A. And then I realized over the years working with people why, in my view. So a lot of women that have chronic fatigue, I work with very special people, very ambitious people, very with it, successful women that all of a sudden can't. They have to stop. The way I see it is their inner feminine kind of cracking the whip and saying, relax, look within, tap in. And it's interesting with two men that I work with, they happen to have I'm not saying anything offensive, but they happen to have an overdeveloped feminine where they were shut down in their masculine being young kids, okay? So their fatigue is also just being out of balance of their nature.
Okay.
Right? So a lot of what this healing is bringing you back to your essence. That's not saying you have to be overly woman, overly man, overly feminine. But in the psyche, the way I see it is it's cracking the whip and saying, pay attention to yourself.
Yeah, that is so true. It reminds me, like one of the hypnotherapies I did when I had burnout, I did see my masculine and feminine, and one of them was like standing up and the other one was like crunched down, like, oh, I can't do this anymore. So I saw it was out of balance for sure. Yeah.
Feminine, the one crouched down?
I'm trying to remember. I think it was a feminine, yes. Yeah.
That's exactly how I see it. The way I see it is the feminine has been crouched down, beat up, and she's like, give me a break, please, let me speak.
And it made sense because I crashed after the birth of my first child, and the place I was working in didn't want to give me more time off. I only had like 3 weeks or something, and I was in a wheelchair. And actually my feminine was saying, rightfully so, you need to take more time off. So it was a big crisis with work until I had to resign to take some time to actually get to know my baby, because I hadn't had the chance until then. So yeah. Thank you, feminine, because it was a really wonderful 6 months off that I had with my baby. And otherwise I wouldn't have had it, because I had to go through this crisis before I would actually succumb and do something that my environment thought was not professional. Because where I worked, people didn't take time off. They just like give your baby to somebody else and keep on working. Even my obstetrician said that she just had a baby, and a colleague came and said, congratulations, you're on call this weekend. And that was my obstetrician, so yeah.
It's hard. It's and also I've been also having discussions lately with people about the work environment, men, women, whoever, that a lot of our health issues come from just the norm of our work environment. We don't really get time off. We're not in nature. We're none of these things that are just normal to the human. And just that a lot of us are in front of computers all day, straining our eyes, and we are in an environment that 80% of our time is there, and it's sometimes we don't like the people we work with. Not to say it like that, but oftentimes it could be a stressful environment. You're not around people oftentimes that you just click with or love. So we have been really also in the same way. Our natural or societal way of working also creates distress and disease, back pain, you know, just normal things.
Yeah,
Which is unfortunate.
yeah, I feel so much better always when I can just go on a holiday with my kids, obviously, or just be home and in my own nice environments, where there's everything is of my choice. Because if you go out in the world and you work, you can't always determine who is going to walk into your life, either to work with or work for. So, yeah, it's a tough one, that one. I guess we just need to, I don't know, how do you deal with that?
You
Try
just do.
not
You do. You know.
to.
So
Yeah.
I think it's interesting because a lot of younger people are wanting themselves, you know, and they don't have the same tolerance of working somewhere for your whole life. And I get it, which makes sense. But a lot of things are changing. A lot of things are changing, I think, and it's hard to keep up sometimes with what's next. Um, but in my belief, I do also feel that due to the changing needs of our reality, our medicine will also have to change. We're
Oh,
going to have to
yeah.
keep up.
Yeah, there is already change happening, but you know, the masters always pick up 10 years later. So I'm usually at the forefront of any change. I mean, I'm not the first one, of course, but maybe in ophthalmology, one of the first ones to actually look at the holistic treatment. I don't know any other ophthalmologist that ever has considered doing some emotional healing with uveitis patients. That is completely new to them. But I want to do it. I think it could be very useful. Yeah, absolutely. I think we addressed most of the things that I set out originally, because in the subtitle of this talk, I mentioned what's the difference between fatigue and burnout. And my idea was fatigue is actually normal if you don't sleep, or you just climbed a high mountain, or you just ran a marathon. But burnout is being exhausted without doing extreme exercise, or even when you had enough time in your bed and you still feel tired, and it's a chronic problem. It doesn't go away no matter how much you sleep and rest and do nothing. So that's the difference, in my opinion, between fatigue and burnout. And of course, burnout is a very big subject, which in my opinion is very holistic. It's not just not having the coping mechanisms to deal with the outside world. I do look at how it influences you physically, and how you can also nurture yourself physically, but also, as you discussed, empty your emotional buckets is very important, and then have better coping mechanisms going back into your life with a different approach, and with more conscious choice of what is good for you. Because once you've listened to your consciousness, you will know, I can do this, I cannot do that, and set boundaries, and saying like, no, I'm not going to run marathons anymore. I'll stick with, 5Ks only, or whatever you need to do. Limit amounts of time with certain people that are not good for you. Um, spend more time in environments that are good for you and nurturing for you. So there's all of these different answers that you will get on how you can change your life for the better. And yeah, what else? Why do women get so much fatigue and burnout? You've explained that in our society there is a lot going on. We never really rest.
Never.
Never. We're constantly busy. We don't have enough contact with nature anymore. Why do you think? What are the other reasons why it's so common now? Are those the main reasons why
Why
people
do
have
I think
fatigue?
there's so many?
Hmm.
Why the Well, I think I call it the perfect storm, because I feel like the food we're eating is not up to par. I
Yeah.
feel like we're in a bit of a toxic environment, even physically, like the air we breathe, if it's polluted. We're just battling everything. We're battling everything. We don't get a moment of, just ease. So whether it's emotional stress, physical stress, um, everything we're ingesting is, worse without a better word, toxic. So the food we're eating is not repairing our body. We're not, it's a product. It's not real. Let's just start with that. So we're just battling. Our bodies have to keep up with so many things. So it's the perfect storm of emotional distress, food not being real, and we're overworking ourselves, without even realizing.
Yeah, absolutely. I can feel it myself. Yeah, great. So burnout, fatigue, why? And so what is like, to summarize the advice you give people with fatigue and or burnout? What is like, if you can put like a few points together, what would be your advice summarized?
Well, the advice I generally give is, first of all, not to give up. My number one is that when I was first going through learning about this, and every single doctor was like, it's depression, be on antidepressants. And I'm like, I'm a freshman in college, I'm 18 years old. And it's because of my stubbornness. And like you said, even earlier, a lot of your patients now is that they'll do these things. They'll take the more active approach, because I was always the type to be like, no, this is not appropriate for me, and I'm not depressed. And even if there was an element of low hormones or there was an element of depression, I never gave up, basically. And I have that personality that I'm not a victim, and there has to be a solution. If I was healthy before, then what's happening? What, something happens,
Yeah.
So that's that. And also the element of working within the subconscious mind. So we can consciously try to say affirmations. We can consciously try to say these things. But if you don't work with your subconscious, the things that are below the surface, allow them to come up to light, to be released and to be free, then they're going to continue running, right? It's just going to keep running until it just won't stop, That's huge. The mind and spirit piece of disease, which is barely covered anywhere, is such a big deal when it comes to anything chronic. If it's chronic, it's mind and body expressing something that probably needs to be processed.
Yeah, absolutely. Wow, that was very interesting, and it's so nice to meet you. And where do you practice, and where can people find you?
So I'm technically worldwide. I had an office in Miami for majority of time, and I just let that go recently because my clients are all over the world. So I work virtually over Skype. And I also offer online courses that are self-healing. I particularly have an autoimmune course. And the first, yeah, it's incredible. The first session is for stress relief to particular to autoimmune flare-ups. The second module is everything to do with fatigue. The third is everything to do with pain symptoms. And the fourth is feeling safe in the body and creating a vibrant life. So there are different hypnotic recordings. They're very deep, they're very powerful. So I always say, no driving, give yourself a little bit of time to come up afterwards. But it's like this comprehensive resource that's a really, really nice thing. So if I can't work with you one-on-one, that's also an availability.
That sounds amazing. Yeah, where can people find your online program? Do you have a website?
I do. So my website is my name, dannapycher.com, DANNAPYCHER.com. And my courses are at courses.dannapycher.com, but you can find them on my website too. So, and if you just type in my name, my courses should come up. I also have a weight loss course and an emotional healing course.
That is so useful. I know so many ladies that I need to tell. I need to tell them where to find your courses. Yeah, that is. I'm so happy you're doing this because the world needs somebody like you. And wow, it's very,
You as
very,
well.
very. Yeah, I'm trying my best. But yeah, that is awesome. So yeah, if somebody wants to contact me, I mean, I also have an online course. Like I have a few of them behind me. I don't know whether you can read it or whether it's in mirror writing. Energy booster, time management, emotional healing, and life purpose. Um, yeah, because I find when people have like a big traumatic event, like being out of work with chronic fatigue or burnout, it's a good time in your life to reassess, am I on the right track? So
Yes.
I do explore that. Do you want to keep on doing that, or is this the time that you actually really start doing what you love, like do the work you were born to do, kind of thing? So it's a very precious moment to readdress whether you're on the right track or whether you want a career change or not. So yeah, I love doing that also with people. So I also have I've got 6 modules, and the whole course, you can get it together, is called Burnout Recovery Program, and my website is burnoutexpert.co.uk. So I'll
Amazing.
mention that under the video to make sure there's no spelling mistakes. So thank you again. Lovely meeting you. I hope I see you in person in the next few years, probably somewhere. What do you
Yes.
think?
Well,
Are you
cross
going?
paths. Thank you so much. It was really, really fun. I appreciate it.
It was very interesting. Thank you so much for your time, Danna.
Thanks. Bye.
Bye.